Hi guys, Dr. Blair here from pharmapreneuracademy.com. So today I want to take a minute to answer the number one question that I get from people, which is what kind of consulting business can a pharmacist build? So if you're just finding my site, this is probably the biggest question on your mind, right? So we've all been there before, but if you've been here in the past, then welcome back. But for those of you just finding me, I get this question a lot. So I've decided to construct this article that will hopefully answer this question for you. However, be careful. This information has been known to cause the following symptoms: excitement, nervousness, insomnia, permigran, racing thoughts, irregular heartbeat, and much more. So, in all seriousness, there are many types of consulting business and as many as an innovative pharmacist can imagine. With provider status knocking at our door, learning your options now can help save you time and money in the future so that when provider status does become a reality, you'll be able to hit the ground running and you won't be scrambling to email me trying to figure it out. So, first, let me start with my story. I started my consulting business because I lost my job in 2014. I was about 6 months pregnant at the time. Now, at that point, I was able to scrape together some PRN work and make it through the rest of my maternity leave. But after I had my daughter, I had some time to reflect, and I knew I really didn't want to go back to those long hours in big box retail pharmacy. My family's finances depended on me working, so I knew that I needed to make my relief and consulting business work. I began managing the MTM program for one of the local pharmacies I did relief for. And as I learned more and more about MTM, I began to share it on my blog and on LinkedIn. Pharmacists began contacting me for advice about how they too could begin consulting. I talked to so many pharmacists who were really unsatisfied, and it just broke my heart. So here I was, loving my MTM business and trying to market my business to grow it locally, when what I realized was pharmacists needed help globally. So in September of 2015, I put together a very small coaching program and took on 3 clients. I kept very detailed notes of our conversations, and I was able to identify some of the common barriers and also the similarities in the questions that they were asking. So I began outlining all the information that I was sharing with them. In December of 2015, I pre-launched an online e-course. 8 people joined that first beta test group. Then I launched again in March of 2016, and 16 more people joined. After working out some more of the kinks, I reshot the entire course because I'm a perfectionist, increased the price to what it is now, and added even more members. In June of 2016, I launched Lesson 7, which covered chronic care management and physician quality reporting system. In September 2016, I launched Lesson 8 on collaborative practice agreements, pharmacotherapy, MTM referrals, and transitional care management codes. You see, I never set out to build a community that has helped over 50 pharmacists and counting to increase their business acumen. If I had started with that idea in mind, it would have been way too overwhelming. So, my unique point of view is that pharmacists need to prove their value by developing relationships and actually proving their value. This may not equate to a bloated 6-figure retail pharmacist salary. Ooh, did she just say that? Yes, it may be unpopular, but I feel that the high salary that community pharmacists enjoy is actually holding us back. I've heard this called the golden handcuffs, which is a fitting term because many of those times those handcuffs are also connected to some kind of crushing debt, student loan or otherwise. What upsets me the most is when people expect everything to be done for them. They want someone to create a dream job for them and then ask them to come do it. That's just not the way it works. You have to create a dream job for yourself. Now I am ready to help pharmacy take part in a larger conversation about innovation in healthcare. I think we can do it better, cheaper, more connected, and more truly patient-centric. And I feel like this can only be achieved through interoperability. The first step in achieving this interoperability is to connect pharmacies, clinics, and acute care settings. This can be done through collaborative practice agreements and pharmacist-led clinical services. Next, we may be doing it with software, artificial intelligence, who knows? Which brings me now to the innovative pharmacist out there who wants to start a consulting business. These are some of the options they have and how they can get started. Now, if you don't want to get stuck behind the wave of clinical pharmacy consultants, keep reading and I promise it will be worth it. So what are a few types of consulting businesses? First is the implementation specialist. This person would focus on helping community pharmacies implement sustainable MTM programs. They would focus on staff training, organization, setting up systems, and automating the MTM process as much as possible for the pharmacy. They would help the store put in place protocols and procedures for all staff members to be trained in MTM. More information about the organizational systems and staff training is contained in Lesson 4 of the e-course at pharmapreneuracademy.com. The next possibility is the program improvement specialist. This person would consult with pharmacies to help them improve existing programs. These programs could include, but not be specific to, MTM, collaborative practice agreements, or other clinical services. The consultant would conduct a SWOT analysis on the pharmacy and propose any changes based on the assessment. Some areas of improvement may be physician collaboration, improvement in patient adherence measures, completion of more CMRs, or even added community services such as vaccination clinics. More information about how to improve clinical programs is contained in Lesson 5 of the e-course. The third option, management consultant. This person may work closely with software companies, telehealth companies, diagnostic testing companies, or others to help them improve collaboration with community pharmacies or even their patients. Check out my interview with Deloitte management consultant Sonal Shah to get a few more ideas on how you can become a management consultant. Number 4, the physician clinical consultant. Many pharmacists are becoming increasingly interested in partnering with physician groups. It can bring personal fulfillment to the pharmacist and a very valuable service to the physician group. A few ways that pharmacists can help physicians is by coordinating a chronic care management or transitional care management program for the clinic. By focusing on the quality reporting system measures that a physician is being graded on, a pharmacist can put together a care plan that will improve patient outcomes and help prevent penalties from the newly introduced MACRA legislation. Pharmacists can offer more services such as transitional care management, MTM pharmacy consults, and even pharmacogenomic testing. More information about these services can be found in Lesson 7 of the e-course. Fifth is the point of care testing services consultant. This person would be an expert on collaborative practice agreements that would allow pharmacies to implement CLIA-waived point of care tests. Such tests may include pharmacogenomic consultations, rapid diagnostic screening tests, preventative screenings, or even narrow therapeutic window medication testing. More information about point of care testing can be found in Lesson 8 of the e-course. Lastly, the one-on-one disease state specialist. This may be the first type of consulting business that comes to mind when thinking about what MTM consulting services are. Now, I intentionally placed this one last because I feel that it has the smallest chance of supporting a successful business model. This includes very niche, cash-based business models where patients are supposed to pay the pharmacist on a per appointment basis to be a health coach or anything like that. If you are interested in this type of consulting business, do not join this e-course. It is not a good fit for you, and you will not find what you're searching for here. So what will you find inside of the Pharmapreneur Academy e-course and community? 1, a community of like-minded pharmacist entrepreneurs that are striving to build one of the above businesses, minus the health coach one. 2, downloadable templates of all of my information, checklists, presentations, and marketing materials. Number 3, lessons on business building, consulting options, identifying your target market, marketing strategies, scaling your business, social media secrets, chronic care management, physician quality reporting systems, transitional care management, and even collaborative practice agreements. You will have access to months of research distilled down into about 9 hours of video lectures. This is a self-paced e-course, but you can receive guided group coaching from me and from the other pharmacists who have succeeded in building their businesses. We accomplish this by giving you access to forums and all the past discussions. We also have once monthly mastermind calls where we chat live for about an hour and a half with some of the other members of the course, and we set goals together and we really hold each other accountable. So many great discussions have come out of the mastermind and have actually guided the content of the course. So lessons 7 and 8 were actually developed because of member feedback. So I want you to feel like if you join the course that you will have say in future lessons and in the information that is contained in the course. I really take into account your feedback, and I want to provide you with the information that you need to build your consulting business. So if you're ready to get started, go to pharmapreneuracademy.com and join to get instant access and save $100 before October 31st, 2016. If you have any questions at all, feel free to email me, Blair Thielemeyer at btpharmacyconsulting.com.